Hey everybody, my name is Allison Taylor. I am a certified hand therapist in Dallas, Texas, and I wanted to talk today about hand arthritis, right there, okay? Because this is something that a lot of people have been given misinformation on for many, many, many years. Most people, when they find out they have arthritis or think they have arthritis, they feel like that is their fate. There's the rest of their life they're going to be in pain, and that is absolutely untrue. There are so many things we can do for that. Going to a hand therapist is a great way to start if you can get a referral from your doctor. But if not, I'm going to give you a couple of tips and tricks that you can do at home that will really help you get through this. Again, a lot of times strengthening will work, but it's not going to work while you have pain. So don't start squeezing a ball and hope that your strength will improve and the pain will go down. That's not going to work either. So we've got to look at the muscle imbalances that are created. We've got to look at the joint faults that happen. But what we really need to look is at the nervous system. We need to look at the neural system because pain is reported in the nervous system. Now, what is interesting about the hand is you have a lot of sensory nerves in the hand and they're right in the skin. So what you'll find is where you have the most pain, that your skin is the tightest, right? So at the base of your thumb is going to be really tight. And when you bend your thumb, you bend your wrist, it gets worse because it's literally stuck at the base. So the bigger the joint becomes, the more pain you have as that skin tries to go over that area. So even though your x-ray may show some advanced arthritis, especially if you have good range of motion, like you have really good range of motion, you just have a lot of pain, we're not going to look at it as a joint problem primarily. We're going to look at it as a nerve problem. And the nerves sit right over the joint, okay? So the number one thing that I recommend for people when they come in, so if you were coming into my clinic with arthritis diagnosis, I'm going to tell you a couple of things I would tell the patient immediately. So you want to get one of these tiny little vibration balls. I would suggest you get the pink one because the pink one you can find easier. I'll put the link in the comments below, but it has a little button that you press right here, just right there. And now it's running and it's on a very light vibration. And what you want to do with this is take this and put this anywhere on the hand or the joint or the fingers that hurt. Now, what's fascinating about vibration, you can use this anywhere. Back pain, leg pain, hip pain. I use it on every single one of my patients, and most of my patients buy this little ball. Okay, it's about $22 on Amazon. It's not very expensive. But what you want to do is put it where the pain hurts, as long as it doesn't increase the pain. It might be a point in time that you don't like it after a while, so just do it for a little bit to start with. So do it in the hand, do it on the fingertips, do it on the top of the hand, and anywhere on the forearm. So fun trick, the nerves that innervate this top part of the hand right here, which is usually the most irritable nerve, comes from up here near the elbow, right? And so the nerve that's on this side, down in here, comes from the elbow as well. So you might notice your hands feel stiffer in the morning when you get up because you've had your elbows bent at night. So get one of these little balls and start rolling anywhere where you have pain. It should feel good, not bad. So we're not gonna do anything that feels bad. So that's our number one thing that we tell our patients that come in the door. The second thing we do is we tell them to get a chip clip. Now, you got to make sure it's not too wide. This is a concept from a Dynamic Stability of the Thumb paper by my friend Virginia O'Brien. But I use this chip clip slightly differently, but it should be pain relieving. So what you want to do is you want to take it and put it in the web space right there. So the idea is that you're going to relax that muscle and put your thumb in a better position. But what actually happens is, for me too, is it's gliding the skin. So again, if the pain receptors are in the skin, I need those pain receptors to be free. I need the skin to be able to glide equally easily over those joints, okay? So you can't obviously do it up here for a finger pain, but this will help lengthen out that nerve that covers the whole top of the hand and see if we can kind of get everything gliding in the right direction, okay? So the next thing that works really good, oh, just by the way, on the chip clip, right? You want to have something that is small if you've got a very small web space. So find a chip clip that's smaller. Wear them about starting maybe 2 minutes. If you get where they don't like them, even in that time frame, take them off. But while they're on, they should feel good, right? So about 2 minutes to 5 minutes maximum, a couple of times a day. That will start to help stretch everything out, relax this muscle, kind of get everything where it should be. And then after that, you want to get a tiny little tool, and you want to use this with lotion. So this is the tiny tool that we use. This is kind of a pottery tool, but I buy them at the craft store. So If you can get one of these, and then you don't want a sharp edge, you don't want it to be rough on your fingers, you want to be able to take this with lotion and very gently use it without scratching yourself. So you're going to take this and you're going to free up all these little creases. To see all these creases in your skin, you want all of these creases to be loose. So where you get tight, like right down here, most of the people will be like, it hurts right here. Sometimes it hurts on the top, but you want to take this tool and you want to free up in tiny little strokes, like you're whittling away at some wood. Tiny little strokes. Just free up that skin anywhere around the area where there's pain. So this will work on the nodules of your fingers. This will work on these PIP joints, even up here at these MP joints. A lot of times what you'll notice is when you push, say on an index finger, it hurts more, or even the thumb would hurt more. But that's because this same nerve that runs down here to the top of your hand to your index finger is very connected at the base, right? So anytime you hold something or something hinges like a coffee cup on this index finger, that in itself could make your thumbs hurt more, right? So again, we think there's nothing can be done. There's so much can be done. We can get rid of this hand pain, especially if you have great range of motion. One of the other things that I really highly recommend is called poly pellets. I can put a link in for that as well. I'll make a video at work to show you what those are. But we get a big tub of plastic, the little bits of plastic that are like weighted blanket filler or the Beanie Baby filler. And so we want to have your hands immersed in that because you do want to keep moving with arthritis. The problem is you don't move because it hurts, but you can move freely in this poly pellets really, really nicely without any pain because the brain is actually going to concentrate on the plastic. It's kind of like the ball. Once you give the brain something else to think about or focus on, then you can do more. And so vibration and this plastic, this poly pellets is amazing. Later we'll do a video where we talk about taping, kinesio taping, and how much that can help you. But until then, that's just like kind of top 3 or 4 things that you can do for arthritis hand pain, and it works amazingly well in any other body part. All right, thanks.